I used to walk at least about 5 to 10,000 steps a day. Then eventually I started to slow down. I was wondering, maybe I was just getting old.
When we were going home, walking up the pedestrian overpass, she nearly passed out.
Kung dati kaya kong mag-walking ng noon 10 ikot, napansin ko, kalahati pala ako, 5 ikot pa lang. Pagod na ako.
You know, I had really some difficulties in breathing. Just going up the stairs in our house is already a challenge for me.
Because I collapsed. No previous experience, no nothing. All of a sudden it came. I never knew it can happen to me until it happened.
I went to a pulmonologist because I've been coughing. She insisted on that day when I went to see her that I should get a 2D echo.
They found out my pulse was 29 and 30. So the doctors got scared that I might collapse.
Doon ko lang nalaman na ako pala ay mayroong aortic stenosis.
When I learned I have this heart disease, I got scared.
And during the medical checking, they found out that my calcium count was very high. And they told me to consult my cardiologist. That's how I found out about the stenosis.
Ang sabi ng heart doctor ko, sabi niya, ang puso mo nagpa-pump ng 210, 10 na lang yung lumalabas. Napakasikip ka niya. Kundi ka lang very strong ka niya, magko-collapse ka anytime.
He was already looking into some concern that I have regarding my aortic valve.
I was so surprised because they all told me that my aortic valve was not working properly.
What I know of aortic valve replacement is that it's an open surgery. But in the case of Dr. Posas, he has brought into the country the technology for what you have, the cold TAVR.
They put it inside something and they don't open. That's the major part. They don't open your ribs. They don't open anything. It's just through the groin.
The procedure is really that would make a patient difficult to handle. When I decided to have that procedure, it really changed my life.
When I had my first TAVR, after one day from the operation, he comes around and says, "Sto, I want you to stand up, start walking." So I said, "Oh my God." I said, "How can you do this?" He just said, "Take my word for it." The recuperation happened so fast.
It wasn't painful, and my recovery was very fast. And from then on, I've lived a normal life, travel and do my exercise.
In about 3 weeks or 1 month's time from the TAVR procedure, I was already playing in a band in San Francisco.
Tapos after 1 month, pinapapunta daw ako sa room. Yun na, nakita ko ni mommy ko kumakain na ng fried chicken. McDo, yun daw yung unang pinabili, yung McDo. Tapos ang katutak na oyster. Oyster. Yung tumira na, sabi ko, ay parang gumagaling na talaga.
I can work in my home now. I don't have house help. So I don't feel I'm a patient.
She did not really need that much care after TAVR. Kasi very mobile, very independent.
I guess I'm living proof that TAVR works.
And I'm happy I survived.
Can sense myself should be, getting back to normal. And I'm thankful for that, especially to Dr. Posas. And St. Luke's, of course.
They're all very compassionate. They're all ready to, to accommodate your needs. And they're always smiling. And when they leave you, you feel cured.
At St. Luke's Medical Center, every heart has a story, and every patient matters. With more than 300 successful transcatheter aortic valve replacement procedures, St. Luke's Center for Structural Heart and Vascular Interventions is proud to be restoring hope, strength, and quality of life, one heart, one life at a time.